Hello viewers, I want to talk about children with autism spectrum disorders, or in short Ph.D. Quite a lot of information has come to us lately as educators, as parents and concerns about children with autism spectrum disorders, and I can just use autism for now. This is because a few years ago, less than 40 years ago, these children were not well known and there were not many. As a matter of fact, we used to be told when we were in school that it is 1 in 10,000. Today, we are talking 1 in 50 children, or some statistics even say 1 in 36 children. So you'll find varied statistics where they say it's 1 in 100 children, 1 in 56 children. But nevertheless, the most important thing is we are aware that these children are really many and they are increasing day in, day out. And the concern is, what is happening with these children? Or what is happening with this particular condition? As we go on, I just wanted to introduce the definition and the characteristics of these children. And as we take courses later on, we can get into depth of what type of child it is. So autism spectrum disorder is a developmental disability that is caused by differences in the brain. Many people with autism have problems with social, communication, interaction, and they have restricted or repetitive behaviors or interests. These are children that once they get, for example, they get to do one thing, you cannot remove it from them. They want a piece of paper, you cannot remove that piece of paper, and they take the same piece of paper. I remember a young boy who was in the age of 40s, I'm calling him a boy because he had severe autism. He will pick a leaf every morning, and that leaf, if it withers, he gets another one, and nobody knows how he gets it. Throughout the day, 7 days in a week. So they have stereotype behaviors that are unique in themselves. So children with autism have different ways of learning, they have different ways of moving, they have different ways of paying attention. And as parents and teachers, we need to know how to identify these children quite early so that these children can be helped. We have a very high percentage if these children are identified early enough, whether they are severe or they are mild. So there's children who have hypersensory, they are very sensitive. Their senses are very sensitive. You find when somebody is talking, they want to hold their ears, or maybe if something is, there's a noise outside, they hold their ears, or they don't want to, or they close their eyes, they don't want to see that light. That is hypersensitivity. And hypo, they have no feeling when something, even if it's very loud, or maybe you have pinched them, they don't feel, they don't react to that feeling. So these children are with us in schools, at home, and we want to help the teachers and we want to help the parents. I want to talk about social communication and interaction skills of children with autism. What are some of the things we look for? Or what do they do? These children avoid or do not keep eye contact. We know there are people who are shy, who don't keep eye contact. But it is so gross for children with autism that you can actually notice there is something peculiar about them. They don't have eye contact. We actually say they don't have touch with reality. They do not respond to their names as early as 9 months of life. While it could be something else, but if you find that a child is not responding to their name when they are called, then we need to start getting concerned. They do not show facial expressions like being happy or angry or sad or surprised, like a 9-month baby. When they get surprised or when they get frightened, they're just there, they don't show any emotions. And they also do not play simple interactive games up to about almost by the time they are 12 months. And you know, at 12 months, baby is a very active child. They may not sing, they may not dance, and up to almost 60 months, they are not interested in some of these normal behaviors of a developing child. These children also have restrictive or repetitive behaviors or interests. For example, lining up toys or other objects, they get upset when order is changed. If you have a child in class and the certain way she arranges her books or toys, and you dismantle that order, they get upset. They repeat words. or phrases over and over and over. We talk about echolalia or echolalic speech. They repeat something over and over again. Play with toys the same way every time. Like, for example, I've just given an example of this boy who used to have a fresh leaf, green kabisa, every day, every time you see him. So they play the same way. They may focus on an item or just a certain item. Like they may focus on your hair if you're a teacher or a parent, or just focus on your face and they just look at your face, or just focus on your hand and they'll pick that hand and play around with the hand. They may take you to where there is a switch and they'll put you to be making you switch off and switch on the light. Just some strange kind of behavior. They get upset with minor changes. For example, you take the child to school through a certain route, and this particular time you decide to change, the child will get upset if they are in the position to know so. They have obsessive interest of things, and they also follow certain routines, which routines they don't want anybody to move away from, or they don't want to be distracted. Other behaviors that you find that are stereotyped with children with autism are such like flapping their hands or locking their body like this. All the time the child is locking. Even when they are not doing anything, they're just locking. Or spinning things around them. Just maybe they might just play around with something, or just flapping maybe a piece of paper or pages of books just around the face. So these unusual reactions and activities, as peculiar as they are concern for parents and concern for teachers. They may also have unusual reactions to smell, to sound, to taste, to look or feel. Other signs that we could talk about autism include delayed language skills. You find the child, maybe even at 2 years, they have not developed any language. They don't have any active language activities, even by 3 years or by 5 years. Delayed movement skills, they are still delayed when you compare them to a child of 1 year who is very active, who is running up and down. They are not active as such. Delayed cognitive and learning skills. When they are in school, their cognitive skills are lower. Their level of understanding are lower than that of a normal child or a typically developing child. They could be hyperactive, impulsive. Hyperactive means that acting without a goal, running up and down, sitting, getting up, getting out of a class, going to play with the side when the other children are working in class. Impulsive means acting without particular thinking, without thinking about the consequences. Or inattentive behavior, where they just donated. Some of them could be having epilepsy, they fall. And some types of epilepsy, it's not necessary to fall like the grad mal, maybe just to drop, just a sign of dropping. Within seconds, they have dropped something and then they pick it up. We'll talk about epilepsy later on in the course. Unusual eating behavior and sleeping habits. Sometimes they don't want to eat, or sometimes they overeat. Sometimes they sleep wrong hours. They're supposed to be sleeping at night. They wake up at night and sleeping daytime, or they sleep and wake up. Just habits that are a concern to the parent. Gastrointestinal issues, for example, constipation. You find the child is always constipated. Unusual mood swings, emotional reactions. Those are some of the things you find with children with autism. Anxiety of some kind, they are stressed, excessive worry. And it's not that they are being beaten or they are being punished, they're just worried. Yeah. And others, you'll find that they have no fear at all. They lack fear. They don't know what to expect. They don't know dangers. Now, what is a bit worrying is autism spectrum disorders come with other conditions that make it very, very complicated, like eating habits, sleeping habits. Constipation can also come with other conditions like intellectual disabilities or ADHD. They can combine with any other condition. And we are going to deal with this when those who are interested in coming to the course, we are going to teach how to deal with each and every aspect. So children with autism generally can be quite challenging to have a child with that, with autism. But we want to encourage the parents and teachers that if your child has any of the tendencies that I have talked about, get in touch with us. We'll give you advice where we can. We'll refer you where we can. We work with people who can actually work with these children. We also work with the children. We do assessment. We'll give you all the information that we know that can help you help your child, whether at the school level or at home level. Thank you so much, viewers. The next condition we are going to talk about is specific learning disabilities. If you have any queries, we are going to put this information in our YouTube channel. You can ask questions, you can comment on our YouTube channel so that at least we can find out what else can we do to help parents and teachers and friends who want to help people with autism. Thank you so much.